Good afternoon, everyone. So, we are meeting after a long time, and today's topic of discussion is irritable bowel syndrome. So, let us understand what is irritable bowel syndrome. How often we come across someone who is having bloating or abdominal pain, constipation, or loose motions once a day or many times. Is often accompanied by presence of mucus and stools, and they have gone through a number of tests, blood tests, intensive tests like colonoscopies, and nothing is concluded on the reports. So, what is IBS? IBS is called as irritable bowel syndrome. It is a diagnosis of exclusion. When I say it is a diagnosis of exclusion, it means if you are not suffering from any demonstrable pathology, no infective pathology, the colonoscopy is negative, you are not suffering from colitis, your sonography is normal, and there are no red flag signs. So, what are red flag signs? Red flag signs are the signs which are alarming. The first one is more than 10% body weight loss, the second one is blood in stools, and third one is fever. So if your constipation, your loose motion, your abdominal pain, or your mucus and stools, or your bloating is associated with 10% or more than 10% body weight loss, blood in stools, or accompanied by fever, then diagnosis does not go in favor of irritable bowel syndrome. We have to investigate to rule out the possibility of malignancy or tuberculosis or anything else like ulcerative colitis or Crohn's disease. Also, if all of these signs are seen in a patient who's more than 50-55 years of age, then diagnosis goes in the favor of a malignancy. So now you all have understood that irritable bowel syndrome is a diagnosis of exclusion. Means if you are not suffering from anything and there is no demonstrable pathology, that means you are suffering from irritable bowel syndrome. If you have symptoms like bloating, abdominal pain, constipation, or diarrhea with or without presence of mucus in stools. Okay. So our Indian population may have more than 70% of the people, even in the pediatric group, suffering from these conditions. And in India, gut health is very important, and in most homes, it is related to the overall health of the individual. As a physician, I see patients every day who come with a complaint of constipation, straining at stools, bloating of the abdomen, gas, loose motions, increased frequency of motions, mucus in stools, and they are very, very unhappy with their complaints in a way that their efficiency is affected. And they have gone through many tests. They go from one doctor to the other doctor because they do not get results. So how do you approach this IBS is, first, you have to understand the cause of the IBS. What is the cause of IBS? It could be a post-infective sequelae. If it is recent, you suppose suffered from typhoid or some other illness, some abdominal infection, and then you have got these symptoms. It could be a post-infective sequelae. It could be because of a psychological cause. In most of the cases, it is stress. You have to identify the triggers at personal as well as the social front. And the third important cause of IBS is dietary. So, diet plays a very important role in management of IBS. So, it is seen that FODMAPs, that is fermented oligo, di, monopolysaccharides, which in common man's language we call as sugars or carbohydrates, should be minimized. You have to identify the foodstuffs which are triggering these symptoms. The bloating, many people are allergic to fruits, some are allergic to eggs. Most of the pediatrics, the patients which I see in the pediatric groups are allergic to milk, which we call as lactose intolerance. Some are allergic to raw vegetables or salads. We also see allergy seen to onions and garlic because of high sulfur content. It gives bloating. And carbohydrates in the form of rice and citrus fruits also give rise to these symptoms. So identifying the cause, why are you suffering from these symptoms, is very, very important. So today I gave you an introduction to irritable bowel syndrome, which is very, very common. It is not diagnosed. Patient is disturbed, and it is very important to get a correct diagnosis so that the patient can achieve immediate improvement in his symptoms so that it makes efficiency better. So for diagnosis of irritable bowel syndrome, to identify why it has occurred, to rule out the other causes of your presenting complaints, for treatment of irritable bowel syndrome, and also your personalized, individualized diet for irritable bowel syndrome, you can contact me on the number provided below. You can also put your queries on my email ID. I am a physician from Mumbai. My clinic is based in Sion. I am sharing my link where you can contact me for appointments at my personal clinic. Thank you.